Good afternoon, everyone, and welcome to today's session. Can you please punch whether the voice is loud and clear for all of you? Can you please punch, online students, whether the voice is loud and clear for all of you? Wonderful. Abhijit Chaudhary, Madhuri, Devabrata, Ram Kishore Singh, Prasanna, Bala, Lanka, and many more who are all online. Thanks for joining the today's session. Also, please inform your friends. Oscar is asking, is it too late to join the revision course? Not at all. You need to be super selective in what you are reading and you need to be focused. And you get that focus and super selectivity by joining the video library so that you can go very selectively to first come, first serve basis. There are 100 topics from which 100 MCQs definitely come. There are 200 topics from which next 100 come. And there are 600 topics from which the last 100 come. So in this small leftover time, if you can finish the first 300 topics out of 953, which we have mentioned in the online mbbs.com video library, it's more than enough that you become you are well sufficiently it is sufficiently you are equipped with the required expectation of the examiner. So Oscar, you are most welcome. Please do call our helpline 9000-868-356, who will be able to give you at the throwaway price and access to the video library, online tests, video discussions, 2 lakh PowerPoint slides, and 30,000 MCQs discussed. Everything for a throwaway price for the next 70 days until the NEET PG exam. Okay, now widening and distortion of the structure marked B. What is it? A serious sign of. Typically, it is the area where you have lymph nodes. So typically it happens in the case of the carcinoma of lymph nodes. So this is the carinal area. Any lymphoma will lead to the development of distortion of the carinal area. Surekha, Narsi, please keep punching your answers. Though you have done before we started this discussion, you had been answering. I am very glad that you all participated. Once more, answering the questions here will give you that perspective which makes the revision, double revision, right? And you will be knowing how your other classmates are answering. And that is the best way to learn the correct answer. Now, what is the structure which is being shown? Epiglottis. Epiglottis develops from where, doctor? Typically from the 4th pharyngeal arch. Now, what is the structure of the lung that enters into this area? So you should remember, it is the primary principal bronchus. So you should know all these hilar structures, doctor, in the tomorrow's exam, which is a favorite image-based question. You have a principal bronchus on the left side and epiarterial, hyparterial bronchi on the right side. There is one pulmonary artery, 2 pulmonary veins, and the bronchial arteries are 1 on the right side and 2 on the left side. So that is what you should remember. In addition, you have bronchial veins, pulmonary plexus of nerves, lymphatics, bronchopulmonary lymph nodes, and areolar tissue, which are the components of the Hilum of the lung, which is the favorite question of the examiner. Tracheal bifurcation and carina, they are at which level? At T4 anatomical level. You are being shown masseter at the level of the masseter, which is the artery that crosses masseter, doctor, facial artery. See, doctor, Sunday grand tests are not meant for a detailed discussion. Sunday grand tests are mainly supposed to be the barometer of how good we have prepared entire week. It's like a developmental milestone. So that is the reason I'll try to go a little fast. Some questions which require description, I'll try to get slow. But this is not our regular way of discussion. Let me tell you, our regular way of discussion is a detailed discussion on every question. That happens every day, daily live class, not in the Sunday grand test. Okay, so please don't judge me that I am going too fast like Shatabdi Express. The idea is, at the end of the Sunday grand test, you should identify 10 topics where you are getting completely knockout. Like Rohit Sharma being LBW, you should identify such topics. Go back to the onlinembbs.com video library and you need to do the revision. So that is the whole idea behind the Sunday grand test. Okay, doc? And I promise you, all 52 Sundays, you will have a test 10 to 1, 10 a.m. to 1 p.m. and 1 p.m. to 3 p.m. I will be coming down to do the discussion, right? So I will be there with you throughout your journey until you get the NEET PG MD seat, right? So that is the reason, don't feel alone. Don't feel that, oh my God, I am left over. What happens if I don't get seat? Kuch bhi nahi hai. They're all negative emotions we should be far away from, right? When we have such wonderful classmates across the country, right? And every day a teacher who is available for you to sit with you, to become your classmate and discuss with you, there is no reason that you need to worry or feel worried about the outcome and results. Masseter muscle facial artery is in relation. Now the angle of the bifurcation, splaying of that carina, where do you see? Which chamber of the heart enlargement? Punch your answer, doctor. Question number 56. Let me see your general knowledge. Yeah. Sara Khan, clean bold. Shiva Ganesh Challappa, clean bold. Surekha Jindabad. I have a little sore throat. Apologize if my voice is little husky, right? I always pray God that you give me anything but not a sore throat. A teacher, a physician with a sore throat who can't talk is a most difficult situation, right? So, doctor, this is the carina, left atrial enlargement is what you need to remember. Between right atrium and left atrium, which is posterior, doctor? Left atrium is posterior. That is the reason whenever left atrium enlarges, for example, in the case of mitral stenosis, mitral regurgitation, then it will go and compress the esophagus which is behind it. So, dil ke piche kaun hai? Posterior mediastinum mein esophagus is posterior. And that leads to development of dysphagia, right? Setu Murugan is asking about UMedico app. UMedico is no more updated, doctor. That's the reason you have all the video lectures, everything updated content on the onlinembbs.com video library. So please do enroll if you on the onlinembbs.com video library. Now, one more important thing is, this is the trachea, doctor. The moment left atrium enlarges, it leads to the splaying of the trachea. Splaying of the trachea is what you need to remember. Now, what are the contents of this triangle shown? This triangle is the suboccipital triangle. That is the reason you need to remember the vertebral artery, suboccipital nerve, greater occipital nerve. They're all the components of the suboccipital triangle is what you need to remember. Vertebral artery, suboccipital nerve and greater occipital nerve, they're all the contents of the suboccipital triangle. Then what are the muscles in suboccipital triangle? Obliquus capitis superior, obliquus capitis inferior, rectus capitis posterior, major and minor. They are the muscles which form the suboccipital triangle. So try to remember, doctor, a very important point. All these triangles of neck in anatomy, favorite topic of the examiner. Recently we discussed around 750 MCQs in anatomy from the MDS entrance, last 15 years question bank. It is being uploaded into onlinembbs.com video library already along with the PowerPoints. वहाँ गर्मा गर्म discussion किया था हम, right? So please do review if you have done this question wrong. Triangles of neck is a very high yield topic, doctor. Now, who is this great man in the field of anesthesia? It is J.Y. Simpson, Scottish obstetrician. He is the one who introduced chloroform in obstetrical anesthesia. A patient has carcinoma larynx and you want to do tracheostomy. Which level tracheostomy you want to do? So it is above the level of the thyroid isthmus. भैया tracheostomy में तीन varieties रहता है. High tracheostomy, it is done above the level of the thyroid isthmus. It violates the first ring of trachea. Mid tracheostomy, it is passed through second and third rings and lead to the division of isthmus. Low tracheostomy is done below the level of the isthmus. So you use a cricoid hook to do the retraction in case of mid tracheostomy is what you have to emphatically remember. This is a beautiful question. Can you please punch your answer? I want to see how good you are in this image-based question, doctor. So, you are being given alpha thalassemia, different types, which is incompatible with life. Sureka, Abid Masumi, Simi Ansari, clean bold, Devabrata, Rituraj, Surekha, absolutely right. So typically this is the Hydrops fetalis, the type E. What is being shown, the type D, this is basically the HB, H disease is what you need to remember. Now doctor, here you have been shown a structure. There's a triple helix, alpha chain, glycine rich. We are talking about the collagen. Which collagen is there in the bones? Typically it is a bone. Type 1 is there in the bone. That's what you need to remember. Type 4. Type 4 is in the floor, that is basement membrane. Okay, so this is one list. You have to पट्टी मारने वाला लिस्ट आ गया. 1 होता है bone, most abundant collagen. 2 होता है cartilage. 2 होता है cartilage में cartilage. You remember? 3 is very extensive in skin, lung and hollow organs. 4 is the basement membrane, floor में. 8 is in endothelium, etc. etc. ये लिस्ट जो है ना, फुटवा ले लो, बहुत बार इसके बारे में डिस्कस किया हमने. डेफिनेटली कोलेजन के बारे में क्वेश्चन पूछेगा एग्जामिनर. Now in the barium study which is being shown to you, what do you see, doc? String sign. String sign is positive in Crohn's disease. In the Crohn's disease, string sign is positive. A healthy 6-year-old girl presented in a 3-week history of the lesion under the tongue. ये क्या होता है डॉक्टर? रैन्युला. रैन्युला क्या होता है? Ranula is the retention cyst of the sublingual gland. Sublingual gland का retention cyst. Very good to see 85 online students across the country. So please mention in all your classmates groups, WhatsApp groups that the live class has started of the Sunday grand test. And ask them to join. The more the merry. Where we are all a big Sunday communion preparing for the entrance exam. Now the shape of the epiglottis that is being shown here, omega shape बोलते हैं इसको. Omega shape होता है laryngomalacia में. Keep punching the answers, doctor. Question number मारो, answer मारो. Right? Even if I pass on very fast also. So that way क्या होता है आपको रिविजन प्रैक्टिस हो जाता है, राइट? हाँ. Very good to see Indira. Actually, Dr. Indira, you promised to bring 200 tomorrow. That is today. I'm counting on you. Did you tell to all government doctors free में कोचिंग दे देंगे उनको? आप पूरा एसोसिएशन को ला लो, तेलंगाना डॉक्टर्स एसोसिएशन, गवर्नमेंट डॉक्टर्स एसोसिएशन, फ्री में कोचिंग देते, मेरा जिम्मेदारी, राइट? सो ऑलवेज डॉक्टर, when a recently passed out student gives me a call that, sir, I got in MD General Medicine, MD Gynops, MD Radiology, I'm so happy, sir, I can't believe that I got it. It is one feather in the cap. But whenever a primary health center government doctor says, sir, 5 साल के बाद once more, I got the seat today, MD Radiology, MD Gynops. That is like 5-star, like Army General, 5-star for me. So that is the reason we will always remember, you are MD, MD forever. You are a lion forever. Right? So that's how, any day, but don't compromise. The branch which you wanted to join, you join. If you really like immunology, if you really like forensic medicine, don't join anywhere else. Enjoy to be a forensic expert. If you want to be a plastic surgeon, don't compromise. Don't join MD Dermatology just because seat is available. No. Compromise is the last thing in this life. Only one life, doctor. Jindagi jeene ke liye. No way that you will ever compromise. Now, you identify this procedure. Typically where the ileostomy has been done and it has been rejoined. It's called Bishop-Koop's operation, which is done in the case of the meconium ileus, where the distal ileum is brought out as a ileostomy and the proximal part is being sutured to the bowel. Proximal part is being sutured to the large bowel and the distal part is being brought out as a ileostomy called Bishop-Koop's procedure, which is meconium ileus. Now, ankle jerk. It is S1, S2, C5, C6. Most commonly, cervical spondylosis कहाँ होता है डॉक्टर? Compressive myelopathy, C5, C6 में. And that will make your biceps reflex become areflexic. So very commonly neurosurgeons, if you want to really see this, just to walk into the neurosurgery ward, Ramaya, Buchamma, Sitamma, Lachakka, so many people will be sitting with the neck collar. Unko simply jaake, only one thing you check, biceps reflex, areflexic. Because most common location is C5, C6, which innervates the biceps. That is how you need to do a case shopping. Kabhi kabhi bore lage to padhai karna. You need to just walk into the hospital and see 4-5 cases, classical cases. Once more interest aata. Similarly, gynops padhne ke liye, just walk into the labor room, spend a couple of hours, have a cup of tea, tell your one of the postgraduate over there, Bhaiya, my alumnus of this medical college, please give me one chance to, like a table tennis, to do the delivery, normal vaginal delivery. And once more you get the kick and come back and sit in the reading room to do the preparation. That's how you need to spice up the preparation, doctor. Patients are in abundance, doctor. Every hospital has abundance of patients, teaching hospitals. Only thing is, there are no people ready, available to teach. But kya jarurat hai? You are already all knowledgeable guys. You are all preparing for entrance means bahut kachra padna padta hai. So, which nerve is anterior to the femoral artery in adductor canal? Saphenous nerve is anterior. Which nerve passes behind the femoral artery? It is the nerve to pectineus passes behind the femoral artery. So it should be doubly sure, doctor, on the anatomy. Tibial collateral ligament. What is it? It is the degenerated part of adductor magnus. Become tibial collateral ligament, one of the stock MCQ. What is the root value of quadratus femoris? Chalo, let me check how many of you are good at. Question number 206, punch karo, doctor. Punch your answer for question number 206. So, Sara Khan saying L234. Devayan also, Devabhrata also. Bala is proposing S123. S1, S2, S3. Actually, S1, S2, S3. Right? Now, Dodds perforator, where is it present? It is typically there between great saphenous and femoral vein ke beech mein, Dodds perforator. All varicose vein surgery mein, you should know what are all the various named acronyms of the perforators of the veins of the lower limb. Medial superficial inguinal lymph node. What does it drain into? It drains the penis and clitoris, classically. Pudendal narrow block mein, how do you direct the needle? Question number 209. Very, very practical question. Let me check what are your answers. So Sunday grand test is all about not becoming happy when you are right, becoming happy when others are wrong, right? So that is where you get inspiration. By oh wrong kiya bole to my better position mein hu. So 209, Madhuri, clean bowl. Rohit, clean bowl. Bala, clean bowl. Asmita, Narsi, Bajia, Satya, Devabrata, Jindabad. Right? So, doctor, ischial spine, no worries. So, ischial spine is the classical location through which you are directing to do the pudendal nerve block is what you should remember. Earlier we discussed this topic many times in anesthesia. So in the online MBBS.com video library, doctor, first finish top 5 topics. They are all arranged in the descending order of priority. So top 5 topics in all 19 subjects khatam karo, 100 ho gaya. Then top 10 topics 6 to 15 finish karo in every subject. Next 200 are over. After that time mile to go to the remaining topics. Every subject may top 50 topics in the descending order of priority. We have discussed, debated and made available in the online MBBS.com video library. These are all circular DNA, plasmid, mitochondria, yeast, but nuclear is not circular. Collagen synthesis required vitamin C, hydroxylation of proline required vitamin C, Hyaluronic acid is the major proteoglycan that you see in the case of the synovial fluid. Melas क्यों होता है? Melas होता है complex 1 of the electron transport chain is defective. Melas होता है mitochondrial myopathy, encephalopathy, lactic acidosis and stroke episodes. Now, hypochlorite production के लिए what is the enzyme required? डॉक्टर मुरली भरद्वाज का स्टूडेंट्स ऐसे क्वेश्चंस रॉन्ग नहीं करेगा. हम बायोकेमिस्ट्री में 50 टॉपिक्स, top 50 topics we have discussed. So this is a favorite topic for both pathology and biochemistry. You should correctly answer. Yash is proposing myeloperoxidase. Anusha also thinks the same. But Bala thinks superoxide dismutase. Bala, don't break my heart. Sara Khan says superoxide dismutase. Bajia says triple D. No, doctor. Sureka, Anusha, Yash, Ravi Kamble, Rohit, Tabare, Jindabad. Doctor, please don't miss this. ऐसे क्वेश्चंस क्या होता है? सिंपल होता है, मगर रॉन्ग करे तो 10,000 रैंक्स पीछे. NADPH ऑक्सीडेज से मिलकर सुपर ऑक्साइड को बनाएगा, इसको कहते हैं NADPH ऑक्सीडेज. सुपर ऑक्साइड डिस्प्यूटेज. बजिया देख रहे हैं ना, नरसी बजिया, मेरे प्यारे बजिया. सुपर ऑक्साइड को हाइड्रोजन पेरोक्साइड बनाने वाला एंजाइम होता है सुपर ऑक्साइड डिस्प्यूटेज. ये हाइड्रोजन पेरोक्साइड का 3 fates are there. One is Fe+2. It will convert that into hydroxyl radical. Catalase will convert that into oxygen and water. Myeloperoxidase combines with chloride and make it hypochlorite. That is the myeloperoxidase. ये सब ऑक्सीडेज रहता है, मगर कंफ्यूज नहीं होना. कन्फ्यूजियस, चाइनीज फिलोसोफर कन्फ्यूजियस क्या बोला? नीट पीजी में कंफ्यूज नहीं होने के लिए बोला, बराबर. So NADPH plus oxidase, NADPH oxidase converts into NADP plus H plus and oxygen superoxide. Superoxide dismutase converts that into hydrogen peroxide plus oxygen. Catalase converts the H2O into H2O, whereas myeloperoxidase will lead to hypochlorous acid formation. That is what you need to remember. No problem. अभी क्लीन बोल्ड हुए तो एग्जाम में क्लीन बोल्ड नहीं होते, राइट? सो डॉक्टर, तो there is a lot of video library. Today learning is very easy. Lot of video library available, books are available, entrance books are available. What I found is the role of the teacher mainly is in the modern time is not to impart knowledge. Knowledge is available everywhere. The role of the teacher is to motivate you, challenge you, stimulate you to go back, correct yourself. The small mistakes where the God lies. God lies in the small things. उसको correction करके आगे बढ़ना पड़ता है, right, doctor? So that is the reason every day now we started a new good habit, 5 a.m. to 8 a.m. in the morning. Please click on the subscribe button. आपको मैसेज आएगा, नोटिफिकेशन आएगा YouTube से. Become part of our help WhatsApp study group. 90086835 को कॉल करो, आपको इंक्लूड करेगा WhatsApp study group में, आपको पूरा classmates मिलेगा. And then we will also put a reminder in that WhatsApp study group. We have 20,000 students in about 80 WhatsApp study groups across the country. Right? You get some of the brilliant students. You can discover a good study partner by being in our WhatsApp study group. right? So to get included, please do call our helpline. So every day 5 a.m. to 8 a.m. अगर time extra time मिले तो मुझे, if my vocal cord edema is not there, then once more 6 to 8 or 7 to 10, I promise one more session in the evening to spend time with you to discuss another 100 MCQs. 100 बोलते ही 100 हो गया online watching. So doctor, from tomorrow early morning we are starting pharmacology. Pharmacology में totally 750 MCQs है topic wise classify करके. Most commonly asked topic to least commonly asked we will do a discussion, right? So please tell your friends also to join our daily live online YouTube broadcast sessions, right? Now glycopeptide is cleaved by glycosidase. अभी आ गया favorite question. 17 alpha hydroxylase is not involved. Come on, punch your answers, doctor. I want to see how is your answer. Question number 217. Dr. Bhuva is saying androstenedione. Surekha bets on aldosterone. Sara Khan is saying cortisol, Panju Attar also. Neha ji androstenedione बोल रहे हैं. देखा ना? How our brilliant classmates, co-aspirants are reflecting. That is very important. But only Surekha Jindabad, aldosterone. So doctor, please don't forget this very important congenital adrenal hyperplasia. Favorite topic, doctor. So you have to pick this up. Go back to the onlinembbs.com video library. आपको 30 minutes review discussion रहता उसमें वीडियो एंड पीपीटी. लास्ट 15 years एम्स, ऑल इंडिया, पीजीआई, जिपमर, सारे जगह पे जो भी क्वेश्चंस आए हैं कंजेनिटल एड्रेनल हाइपरप्लेसिया में गर्मा गर्म डिस्कशन है. सो पिक अप 10 topics at the end of this Sunday grand test and repair those missing links by consuming the video library. So that is the best way to prepare, doctor. So cholesterol banega pregnenolone. Pregnenolone, 17 alpha hydroxylase will take it towards the path of forming 17 hydroxypregnenolone. That will be moving towards cortisol formation. Then it will also take it forward towards formation of estrone, estradiol, etc., etc. So you should remember 17 alpha hydroxylase main goal is to take the metabolites towards the glucocorticoids. Glucocorticoid production is what you need to remember. So it is not involved in aldosterone production. Aldosterone production may 17 alpha is not involved. Aldosterone production may what are all involved with doctor? 3, 21, 11, 18. और एक बार बोलो मेरे साथ 3 7s are 21. 21 minus 10 11. 11 plus 7 18. 3 21 11 8. You need to remember aldosterone pathway. Then 17 alpha hydroxylase के वजह से 17 alpha hydroxypregnenolone बनता है. 3 21 11 will take it towards cortisol. 3 17 beta will take it towards testosterone. So please don't forget this table. Football ले लिया ना? हाँ. Very good. Rituraj rightly reminds 17 hydroxylase causes hypertension. Very good, doctor. Very good. Which drug acts as an antagonist of haloperidol is a very important question, right? Antagonist of haloperidol, you should be very sure. So you should remember ropinirole, absolutely. Upender Bobby Jindabad. Bobby movie देखा? झूठ बोले कव्वा काटे. मैं मायके जा रहा हूं युगेंद्र बॉबी. Now very important, very good. All of you are saying ropinirole. So भैया What are these various drugs? Mechanism is a favorite question. Alpha 2 agonists, clonidine, guanfacine, they have a less risk of sedation, but there is a rebound hypertension with guanfacine, and typically guanfacine is approved for attention deficit hyperactivity disorder. Then dopamine antagonists are all antipsychotics. Risperidone, pimozide, haloperidol. They are the antipsychotics which are used for treatment of tics. Then dopamine agonist opposite to haloperidol, that is ropinirole, pramipixole. They are all dopamine agonists which are typically used in Parkinsonism. Then dopamine depleters are tetrabenazine, which is approved for the treatment of Huntington's disease. You should remember, football ले लिया ना इस slide का. So the beauty part of onlinemmbbs.com video library doctor, every video के नीचे आपको एक PowerPoint मिलता है. Best way to do the revision is, you don't even need to listen to video. कभी-कभी video will make you slow. Run through the PPT fast. 40-30 questions are asked in every topic in AIMS, PGI, All India and all these entrances. We had a detailed discussion, everything made available. I am going to forget बोले तो एक screenshot ले लो and you create a bunch of screenshots that you need to repeatedly revise with your classmates. That is very, very important. Got it? So, what is true about antipsychotics? So, you should remember, haloperidol can be given intravenously. क्यों नहीं? This is haloperidol injection 5 mg per ml, which is the drug acting on GABA A receptor. Zolpidem के बारे में 5 पंक्तियों में शॉर्ट आंसर लिखो. Zolpidem शॉर्ट टर्म ट्रीटमेंट ऑफ इंसोम्निया के लिए Zolpidem is one solution. onlinemmbbs.com video library subscription is another solution. Right? Video library is another solution. It induces sleep very rapidly. It should be taken immediately before going to bed. It is not related to benzodiazepine. It is a non-benzodiazepine. But still it will interact with the GABA A receptor. GABA A receptor. And Zolpidem will preserve all stages of the sleep, and it has only minor effect on REM sleep. Only problem with Zolpidem is headache, prolonged drowsiness and giddiness. Right? Now, the antidepressant, which is a presynaptic alpha 2 receptor blocker, which will enhance the secretion of the norepinephrine and also serotonin, which is that one. Question number 221. Please punch your answer, doctor. अभी देखेंगे कितना गर्मा गर्म प्रिपरेशन है आप लोगों का. Question number 221. What is your answer, doctor? अरविंद कहता है me answering. जिशाम अमीर clean bowl. Yugender Bobby says bupropion. Most of you are correctly answering. Mirtazapine is what you need to remember. Mirtazapine. Antidepressants, antipsychotics, anti-epileptics, anti-diabetics, anti-asthma, diuretics. These are all very high yield topics, doctor. Pharmacology में 20 out of 20 मार्क के बाहर निकलना है. You are all Dr. Murali Bharadwaj students, right? You will make that promise to me. So, doctor, if you go to the onlinemmbbs.com, I will briefly explain you. mbbs.com. Typically, you have a folder. आपको एक फोल्डर मिलता है 30,000 hot MCQ based revision of AIMS, PGI and NEET PG. इसको क्लिक करें तो आपको मिलेगा एनाटॉमी, फिजियोलॉजी, बायोकेमिस्ट्री, माइक्रोबायोलॉजी, एम्स, ऑल इंडिया, डीएनबी and all these exams का topic wise revision. Even whatever that we daily do the revision, no doctor, it is all being uploaded into this. So अभी कल से हम फार्माकोलॉजी डिस्कस कर रहे हैं. फार्माकोलॉजी अगर एम्स का क्वेश्चन बैंक लिए तो highest questions came from chemotherapy, then hypertension drug, adverse effects, analgesics, antiepileptics, diuretics, cephalosporin, HIV drugs, etc., etc. Very recently, doctor, very recently, we have done a discussion of the NEET PG last 15 years question bank. आपको यहाँ मिलता है NEET PG Pharmacology. There are totally 1200 MCQs in the last 15 years of NEET PG, and we have done a 30 hours of discussion. So यहाँ आपको मिलता है भैया adverse drug effects, pharmacokinetics, highest number of questions that have come in the last 15 years of NEET PG and all India. Autonomic nervous system, typically the second largest number of questions. Anticholinesterase, antihypertensives, Parkinsonism, antibiotics, cancer drugs, asthma drugs, diuretics, digitalis, eicosanoids, antiarrhythmics, corticosteroids, hypolipidemics, migraine drugs, gout drugs, malarials, laxatives, antiplatelets. So, doctor, आप क्या करना है कि you need to do a very good usage of this video lectures and the PPT slides. 40-50 MCQs in every PowerPoint along with explanation is available. Quickly peruse through them. Get all those tables, single liners, logical points, atypical questions, nagging questions. जहां भी आप भूल जाते बोले तो एक स्क्रीनशॉट ले लो और get ready for the preparation. In addition to that, from tomorrow early morning we will be starting Devayan, sir, top NEET PG in 120 days program. Can I follow? Definitely. Yes. So, if you enroll in any of the programs, you will get an access to the entire video library, doctor, including this. So, no worries. Right? So, even today's discussion also, we will be scoring it back into the onlinembbs.com video library. We'll be uploading the video, right? Now, so it is the mirtazapine, doctor. How does mirtazapine basically act, doctor? So you should remember, it blocks alpha-1 receptors. And typically it will enhance both norepinephrine and also the 5-HT. Very good. Madhuri, you are right. 5 topics in each of these 19 subjects. Top 5 topics into 19 subjects will give you 100. First wo khatam karo. Maximum 50 hours mein you will finish that. Next 10 topics, fat revision karo all 19 subjects mein. That will finish 200 topics and next 100 questions के लिए आप तैयार हैं. Then you will get confidence. अरे वाह, 200 questions मैं बराबर आंसर कर रहा हूँ, right? Now, so it enhances both norepinephrine and the serotonin release. Also, mirtazapine is said to have some affinity for alpha-2 receptors. Now, what are the adverse effects of mirtazapine, doctor? Increased appetite, weight gain, and granulocytosis rarely. And what are the indications of mirtazapine? Depression, OCD, panic, post-traumatic stress disorder, सीजनल अफेक्टिव डिसऑर्डर, कुछ लोगों को विंटर में डिप्रेशन शुरू होता है, राइट? सो दैट्स कॉल्ड सीजनल अफेक्टिव डिसऑर्डर. So now, doctor, sumatriptan, all triptans you should be good, doctor. Question number 222, what is your answer, doctor? Let me check how many of you are correct. Question number 222 is for a bet. Come on, take the bet, answer the question. Sumatriptan. What is the correct answer about sumatriptan? Should. Bala thinks it is a 5HT 1D 1B antagonist or agonist. Bala, और एक बार सोच के बोलो Bala. Then Harsh Pant is saying contraindicated in epilepsy. Harish Pant or Vallabh Pant, two Pants who are great people in India. Be very sure. Pant Jindabad. Right. So, doctor, you should be careful to give sumatriptan in epilepsy. Sumatriptan is not the longest acting triptan. कौन बोलेगा मुझे? Who will give me correct answer? Longest acting triptan क्या है? उसका नाम क्या है? Who is going to give me the correct answer? Chocolate. Chocolate. Which is the longest acting triptan? Who is going to give me the correct answer? Naratriptan, says Ajay. Aravind, Zomitriptan. Very good. Yuvaraj, you are getting the chocolate. Frovatriptan is the longest half-life time, whereas all other triptans have a half-life of only 2 to 6 hours. Frovatriptan, longest half-life. You are going to remember, कल के NEET PG में same question ditto आएगा. मुझे बदनाम मत करो कि मैं पेपर आउट किया बोल के. Right? Now, what are the contraindications for triptan, doctor? It is vasospastic, so coronary artery disease, hypertension, peripheral vascular disease. Basilar migraine में नहीं देना ट्रिप्टान्स को. Hemiplegic migraine में नको देना. And if the patient is taking ergots, SSRIs, TCAs, avoiding them. Pregnancy and lactation, contraindication for triptan. And it should not be used for more than 2 days a week in order to avoid rebound headache. So these are some of the funda about triptans, doctor. और एक बार हम discuss करेंगे. फिर भी फुटबॉल ले लो. Favorite question. So sumatriptan acts on the smooth muscles of the brain vessels. It is the first selective serotonin agonist approved for the treatment of migraine. It is an agonist, doctor, not an antagonist. It provides rapid relief. Oral bioavailability only 14%. By a first generation antihistaminics को one place they have a role. Who is going to give me the correct answer? 223. Punch your answer, doctor. Make it an interactive session. Right? अच्छा, मुझे एक आइडिया आ गया. मुझे बहुत आइडियाज आते हैं. आजकल हम व्हाट्सएप और यूट्यूब का मैक्सिमम एक्सप्लॉइटेशन कर रहे हैं. पूरा भारत कनेक्टेड. Then I got one more idea. What brings that competitive enthusiasm in us, doctor? Recently I have seen one of the kid playing on the YouTube. Game खेल रहे. Fire बोल के. There are about 20,000 people who are all saying, go to the left side and fire, go to the right side and fire. मैंने पूछा, अरे भाई ये क्या है, गेम्स भी खेलते क्या यूट्यूब में? अरे क्यों नहीं खेलते, जबरदस्त खेलते, मजा आता है खेलने में. Then I got an idea. Why don't we make around 6 to 8 students who like to volunteer to become participants in the quiz? Right? I will give you one link. अगर आप वो लिंक को क्लिक करें तो automatically you get connected voice call like Skype call or WhatsApp call. And when we are having the discussion, no, you can directly speak and your voice comes out. So what is Ramu saying, Harish saying, Rituraj saying, Bajia saying? So we will have that competitive spirit where you are able to instantly give an answer, right? So your audio also comes out. And same time, you can also see the clues, how the people are punching on the chat window. करेंगे क्या? क्योंकि when you listen, some of the 5-6 people fighting on the boxing ring, बहुत मजा आता है preparation करने के लिए, right? So try करेंगे क्या? So those who like to volunteer, please let us know. Please WhatsApp to our helpline 900868 we love to participate in a voice quiz. Panju Attari is saying good idea. Very good. So just you need to volunteer, because yahan to you are all messaging. Very good. Yuvraj is saying, sir, add me, sir. So please, Yuvraj, WhatsApp to our helpline 900868 I love to participate in the audio challenge. Kaun Banega PG Pati. Kaun Banega PG Pati program. Your audio, your voice is heard across India. If you answer wrong also, we will do ragging, right? So be very sure. We will make it like a game. Lot of YouTube games, live games are being played now. So that will make it first time in the country where your highest level of activation. Actually, there is an option where your video also you can open up, and that will also be visible to the students on the live broadcast. Video बाद में जाएंगे, पहला audio try करेंगे, right? Bhuva is saying even WhatsApp we can, yeah. So Bhuva, please WhatsApp that you like to get that opportunity to participate in Kaun Banega PG Pati audio competition show every day, so that entire India will see Kaun kitna pad raha hai. Very good. And I should actually thank one of our students who actually gave the idea. Sir, before starting lecture, put the questions like a PowerPoint slideshow. Madhushri Manya was the one who gave this idea. Even WhatsApp study group ka idea also was encouraged by Madhu. She is not there in today's class. So basically students are the best doctor who will tell what to be done. So remember, even in motion sickness, first generation antihistaminics still have a role. Bhaiya, what are first generation, second generation, third generations? Garma garam bolo. Diphenhydramine, clemestin, hydroxygen, cyproheptadine, promethazine, antazolene, ketotifen, ये सब first generation है. Second, terfenadine, astamizole is withdrawn, loratadine, cetirizine, rupatadine, mesolastin, ezilastin, bilastin, they are all second generation. Oh, very good. Bhuva is asking, sir, start करने के पहले topics दे दो, हम prepare होके participate करेंगे. We can also do like that. So please do message our WhatsApp 900868 Tell that. Please include me, include you into the audio challenge show every day, so that you will get that link. You just click on the link and you get connected into the voice conference. Right? Now, third generation. Desloratadine, metabolite of loratadine. Fexofenadine, metabolite of terfenadine. Levocetirizine, enantiomer of cetirizine. Third generation. So, bhaiya, first generation jo hota hai, they are typically used for allergy, motion sickness and a sleeping aid. They lead to sedation. They are anti-muscarinic, anti-alpha adrenergic. That's what you should remember. Second generation होता है loratadine, fexofenadine, cetirizine, they are used in allergy. They are less sedating than first generation because they have a decreased entry into the CNS is what you have to remember. Alprostadil, it is indicated for erectile dysfunction. Misoprostol is used for induction of the labor. मिग्रेन प्रोफिलैक्सिस के लिए सबसे महत्वपूर्ण ड्रग होता है प्रोप्रेनोल. रेस्टलेस सिंड्रोम, typically ropinirole is used for restless leg syndrome. Penile erection के लिए you use papaverine, apomorphine, sildenafil, etc. etc. Alcohol dehydrogenase, what is the specific inhibitor? Alcohol dehydrogenase का very important. Don't tell disulfiram. It is fomepizole. So please check which is the enzyme inhibited by disulfiram. Disulfiram is the most common wrong answer. Bala corrected, Yuvaraj corrected. Very good. Madhuri, clean bold. So Dr. Fomepizole is the one which is specific inhibitor of alcohol dehydrogenase. So there are two enzymes, Dr. Alcohol and aldehyde dehydrogenase. Please be very sure which one is inhibited by which drug is a favorite question. Now, with regard to the aspirin, what are you going to remember? The duration of the action is dependent on the synthesis of the cyclooxygenase enzyme. That is true about aspirin. Sulfonylureas are very well known, most common side effect. Sulfonylurea लिए तो वो insulin का secret gog, so that lead to hypoglycemia, most common side effect of sulfonylurea. What are the most potent of all anti-inflammatory corticosteroids? Dexamethasone is most powerful. Once more, there is a list, doctor. Prednisolone, hydrocortisone, fludrocortisone, dexamethasone, methylprednisolone, इनका potency कितना है? Hydrocortisone is 1. Everything else is compared in relation to hydrocortisone, which is treated to be 1. Please review that table. Already we made it available in the onlineMBBS.com discussion. Privileged communication. Court of law में judge पूछे तो आप ये मिनिस्टर को HIV बोल के है बोल के नहीं बोल सकते. अगर है तो है बोल के ही बोलना है. Otherwise you can't reveal about patient details to anybody. But अगर judge पूछे तो बोलना पड़ेगा. Privileged communication. Embalming solution is given through arteries. Adipocere typically will take weeks to months to form because saponification is a slow process. Is what you need to remember. Now, doctor, natural stiffening of the muscles after the death is called rigor mortis. Inconclusive autopsy means you can't be able to pinpoint what is the cause of the death. It is called inconclusive. How do you give incision in medico-legal autopsy, doctor? T-shape, Y-shape, modified Y-shape. They're all the various ways by which you give the incision. Discoloration of the death, where do you see? After the death, dependent parts are the ones which show the discoloration. I'm going very fast, apologize me. I request all of you 10 a.m. to 1 p.m. Please take the test. See how others are answering. Then this does not look very fast. My job is mainly to hint you on the answers, identify you where you are going wrong, give you a bit company, and only some questions we will have a detailed discussion. Right? Now, post-mortem lividity. If it is a fast-flowing river and उसमें डूब गए तो post-mortem lividity is not seen. Whereas stagnant river like drowning, then drowning in chlorinated swimming pool, anything can still lead to post-mortem lividity. How are the toxicological studies, preservative which is used? It is a supersaturated solution of NaCl, common salt, is the one which is being used wherever poisoning is there to preserve the viscera. We use supersaturated solution of the common salt. Hyderabad में हमारे घर में पावर चले गया, थोड़ा कभी कभी ब्रॉडकास्ट रुक सकता है, but I hope voice is loud and clear for all of you. Outside there is a beautiful weather in Hyderabad. I am very sure in most of the cities. Nice cloudy weather, feel like running around, lazing around and enjoying a great Sunday afternoon and evening, right? Now, doctor, saturated sodium chloride is the one which is used for preservative for poisoning cases. Pharynx क्या होता है? युवराज is from Vellore, Tamil Nadu. Very good. आप तमिल युवराज है क्या? बढ़िया. Reigning in Vellore. Good. Epipharynx is also called nasopharynx. Now, pharyngeal bursa. बरसा में क्या होता है? बरसा में बरसात होता है. Thorn-walled disease. So, doctor, what is thorn-walled disease? It is basically a benign cyst in the nasopharyngeal area. It is a mucus retention cyst. Mucus retention cyst. It occurs in the midline nasopharynx. It leads to a low signal in T1 and high signal in T2. That is what happens in pharyngeal bursa. Indirect laryngoscopy is used for both vocal cords and epiglottis. Now, बट्टी मारने वाला एरिया आ गया डॉक्टर. पॉलिप्स दो जगह पे होता है. Anthracoinal in the maxillary sinus and ethmoidal. What are the differences? Is the favorite question. Anthracoinal are singular. So solitary polyps are all anthracoinal. ये तो बट्टी, just ball बट्टी मारने वाला एरिया है डॉक्टर. No choice. पढ़ना ही पड़ेगा. Definitely आने वाला टॉपिक है ये. Ethmoidal polyp is seen in adults. Then allergy and multifocal are ethmoidal. Infection is anthracoinal. Ethmoidal is multiple, ethmoidal is bilateral. And if you lift the nasal nares, then you can see externally ethmoidal. But it is backwards to coine. It may hang down behind the soft palate. Mouth को open करे तो दिखने वाला होता है anthracoinal. Ethmoidal are small grape-like masses, whereas anthracoinal होता है trilobed, anthral, nasal, coinal. Recurrence is very high in ethmoidal. Ethmoidal को आप करना पड़ेगा polypectomy, endoscopic surgery or ethmoidectomy. Then anthracoinal polyp also polypectomy or functional endoscopic sinus surgery. Endoscopic removal also is done in anthracoinal polyp. Rhinolalia classa, Rhinolalia aperta. Favorite question of the examiners. Last 20 years से कुछ भी नहीं बदला डॉक्टर. यही क्वेश्चंस पूछता है एग्जामिनर. I have seen 2 lakh students in the last 20 years preparing for entrance, had an opportunity to mentor them. Same high-yield topics, same questions, but different students, right? Now, you should remember Rhinolalia aperta is what you see in case of velopharyngeal insufficiency, not classa. Any hypertrophied adenoids, nasopharyngeal carcinoma, allergic rhinitis that is filling the nasopharynx lead to rhinolalia classa. Classa filled. Classa filled. Aperta empty. Aperta empty is what you need to remember. You'll promise me that you won't forget, right? Now, rhinolalia classa. Rhinolalia classa होता है hyponasality. If you block your nose, nasopharynx due to rhinosinusitis, allergic rhinitis, polyp, adenoids, functional, anything rhinolalia classa. There will be lack of resonance for those words resonated in the nasal cavity like M, N, ing. Then what is rhinolalia aperta? Hypernasality. Empty. That is failure of narrow nasopharynx to cut off from the oropharynx. Or if there are any extra openings between oral and nasal cavity, between short, if the soft palate is short, or if the soft palate is paralyzed, or if there is any perforation in the palate, or you have done adenoidectomy, that lead to rhinolalia aperta, which is hypernasality, is what you should remember. Now, typically if you do adenoidectomy, क्या आता है? Aperta. So why do you do adenoidectomy, doctor? If there is a adenoid hypertrophy leading to snoring, mouth breathing, sleep apnea, speech abnormalities like rhinolalia clausa, then you need to do adenoidectomy. Recurrent rhinosinusitis, adenoidectomy. Otitis media with effusion, adenoidectomy. And if there is any dental malocclusion, adenoidectomy. So फटाफट बोलो डॉक्टर, this table का फोटो ले लो, जरूर आएगा इस फोटो के बेसिस पे 1 MCQ. So hyponasality, common cold, nasal allergy, nasal polyp, nasal growth, adenoids, nasopharyngeal mass, familial speech pattern, habitual, hyponasality, rhinolalia clausa. Hypernasality aperta, empty. Vilopharyngeal insufficiency, short soft palate, submucous palate, large nasopharynx, cleft of soft palate, paralysis of soft palate, post-adenoidectomy, oronasal fistula, anything can lead to the rhinolalia aperta. Schwartz operation क्या होता है डॉक्टर? सिंपल mastectomy. Radical mastectomy क्या निकालते आप? Chorda tympani, incus, malleus, posterior wall, not stapes. So you should know, doctor, radical, modified, radical mastectomy, what are the differences? NEET PG में 10 questions आता है ENT में. These 10 questions come from 30 high yield topics only. 30 high yield topics, half an hour, 30 half an hours, 15 hours. 15 hours से ज्यादा 1 मिनट भी पढ़ो ENT, MS ENT में सीट आएगा. So doctor, be very sure. कचरा पढ़ रहे तो बहुत टाइम लगता है. What is essential खाए तो focused way, you don't take more than 15-20 hours each subject. Except medicine will take 25 hours, that's all. Now radical में mastoid antrum, middle ear, external canal, they're all converted into a common cavity. The tympanic membrane, malleus, incus are all removed. Stapes is left. Stapes is left in situ in radical mastectomy. Be very sure. Whereas modified radical may, in this also, the goal is same. Antrum, middle ear, external canal, all of them are made into one cavity. But the tympanic membrane and the ossicles are all retained in modified radical. That's the reason hearing is retained in modified radical. 21-year-old male after adenoidectomy develops hypernasality. Aperta. What is it because of? Vilopharyngeal insufficiency. What is the speech problem after adenoidectomy? It is because of the vilopharyngeal insufficiency. If you do maxillary sinus lavage, what is the complication, doctor? You can lead to air embolism. Skarsky's ring, where is it present, doctor? At the squamo-columnar junction at the distal end, not the proximal. This is the Skarsky's ring. Typically, it will narrow down the esophagus, and where do you find? It is the distal esophagus. You will find the Scotch string. Cornea where are stem cells present, doctor? At the corneoscleral junction, limbus. Where do you see goblet cells? Typically in conjunctiva. Flectennular conjunctivitis होता है, cell mediated hypersensitivity. Type 4 hypersensitivity is what you need to remember. It is a delayed hypersensitivity. TB, staphylococcus act as allergens. Even proteins of the Moraxella axenfeld bacillus also implicated. Typically between 3 to 15 years, higher in the girls, overcrowded areas, all climates, especially spring and summer, you find flectennular conjunctivitis. Herbert-Spitz trachoma. Herpetic keratitis में geographical ulcer may be seen, dendritic ulcer may be seen, disciform का मतलब है stroma is involved. Metaherpetic keratitis means passive, long-standing disease, not active. Herpes simplex keratitis में disciform जहाँ stroma is involved, you will give topical steroids. Geographical ulcer is a type of epithelial keratitis. Metaherpetic is not active. Dendritic ulcer में topical steroids, nakko dena. That is what examiner want to test out of you. Welding जो करते हैं वो flashlight में ultraviolet rays लेता है. Which vitamin deficiency lead to development of optic atrophy, doctor? Vitamin B. So you should know what are all the things implicated in optic neuropathies. Methanol, ethylene, glycol, chloramphenicol, sulfonamides, chloroquine, quinine, isoniazid, ethambutol, digitalis, evuterone, vincristine, methotrexate, lead, mercury, thallium, carbon monoxide, and tobacco. You know how to wake up your classmates early morning if they are lazily lying down? एक लिस्ट ले लो. कौसल्या सुप्रजा राम पूर्वा संध्या प्रवर्तते. You revise the list. खत्म. साला उठ के भागेगा washroom को and accompanies you with a cup of coffee to the reading room, right? So ऐसे list को ऐसे इस्तेमाल करना और revision करना, doctor. Methanol, lead, mercury, thallium, carbon monoxide, they are all implicated in optic neuropathies. That's what you need to remember. Now, vitamin B1, B12, B6, B3, B2, folate, their deficiencies all lead to optic neuropathies. Rubiosis iridis, neovascularization, कहाँ होता है डॉक्टर? Diabetic retinopathy में. Which glaucoma do you see in cataract? Cataract बहुत soft होके, swell होके, obstruct करे तो phacomorphic glaucoma is the one associated with cataract. Ponseti method of congenital tedipus equinovarus. All India entrance, याद रखो डॉक्टर, simple. Adductor inversion equinus. Last to get corrected is equinus deformity. All India entrance. First is adduction, then inversion. Last comes the equinus. So correct the forefoot varus, inversion, and adductus by abducting the foot beneath the stabilized head of the talus. Equinus is corrected last. Dip joint flexion, proximal joint extension, वो होता है swan. Swan neck is watching. Now doctor, rheumatoid arthritis versus osteoarthritis क्या फर्क होता है? Osteophytes कहाँ होता है? Osteoarthritis में होता है. Rheumatoid arthritis में क्या होता है? Periarticular osteoporosis is the feature of. Periarticular osteoporosis is the feature of rheumatoid arthritis. Generally, erosions are the feature of rheumatoid arthritis. But tell me, which is that inflammatory arthritis without erosion, non-erosive arthritis, characteristic of SLE. अगर erosions है तो OSLE नहीं हो सकता, नहीं हो सकता. Pain and arthritis of the distal interphalangeal joint, where do you see doctor? Osteoarthritis. Dip involvement, only 2 arthritis doctor. Dip involvement कहाँ होता है? एक osteoarthritis में होता है, दूसरा psoriatic arthritis में होता है. Only 2 locations, dip involvement. Thomas Smith arthritis, it is the septic arthritis in infancy. Septic arthritis of the hip in infancy. Complete destruction of the cartilaginous femoral head. And the child will present in the preschool age, with painless limb. Affected limb is shorter. X-ray will show complete absence of the head and neck of the femur. वो होता है Thomas Smith arthritis. 18-year-old male, draining sinus of the left leg with pus discharge, bony pieces. इतना बोलने के बाद chronic osteomyelitis of Gary. If you can't diagnose, you are missing the point. Secondary osteogenic sarcoma, typically between 40 to 45 years of age group. You should think of Paget's disease. Bone forming malignant tumor होता है osteogenic sarcoma. Keep punching the answers, doctor. Parallelly punch the answers. अगर आप right answer punch करना आदत हो गया तो कल के एग्जाम में भी आप right answer को ही punch करेगा. Very good. बाला बोल रहा है Still's disease is rheumatoid arthritis in a child, juvenile. Frozen shoulder कहाँ होता है डॉक्टर? Very commonly diabetes, hyperthyroidism, hemiplegias. If you don't do physiotherapy, continuous reading room में बैठ के अगर exercise नहीं कर रहे, TT नहीं खेल रहे, cricket नहीं खेल रहे, football नहीं खेल रहे, frozen shoulders, you will become topper, but frozen shoulder topper. Enjoy doctor. Physical fitness रहना, physical, mental, psychological, stability, ability, nobility, agility. With that you need to carry yourself the next 70 days to become the topper. Right? Now doctor, compartment syndrome में stretch करे तो ouch pain रहता. Classical earliest reliable feature. Emergency thoracotomy, what are the indications doctor? Any penetrating injury, दिल में चाकू चलाए तो नफरत और मोहब्बत के साथ. Cardiac tamponade, emergency thoracotomy. Major tracheobronchial injuries, emergency thoracotomy. काटना पड़ता thorax को. Tension pneumothorax में intercostal drainage tube चलेगा. That is what you need to remember. Is there any break in the broadcast, doctor? Is the broadcast clear? Is the broadcast clear? Very good. So, Love Preeti is saying, sir, after getting seat, we will do exercise. No. Abhi shuru karna, doctor. Jog. Play. Dumbbells karo. 20 dumbbells खत्म करने के, by the time you finish 20 dumbbells now, you finish interleukins, complement, which is chemotactic, table khatam. Then you do push-ups. By the time push-ups are over, you finished another 50 high yield points. That is how you should prepare, doctor, for the entrance exam, right? Please refresh the browser, doctor. Then it will become clear. Now, so what I want to tell you is, tomorrow when you become consultant, what are you trying to become now, doctor? You want to become a topper, you want to become a MD, you want to become a consultant. It's all a stressful life. Continuously stressed out life is a doctor's life, right? You have to run for investigations, you have to convince 10 people to get operated, you have to wake up early morning to do the surgeries tomorrow. So NEET PG is all that. Preparation next 70 days, mentally, physically, psychologically, morally, you should get ready. Only when you are strong from multi dimensions, the chances of being a successful personality evolves, right doctor? So that's the reason early morning 5 a.m. to 8 a.m. मिलके बैठ के पढ़ाई करेंगे. मेरे लिए भी बहुत मुश्किल है, but still I love to wake up for all you guys, right? Now, ninth intercostal space in mid-clavicular line or fifth intercostal space, where do you insert doctor? It is the fifth intercostal space in mid-axillary line. Thoracocentesis needle, where will you put? Mid-axillary line में ninth intercostal space. So thoracocentesis, you will be inserting into the ninth intercostal space in the mid-axillary line. During expiration, time पे चलाना है, so that you will be avoiding the injury to the inferior border of the lung is what you need to remember. Now, what is the treatment of cardiac tamponade, doctor? Cardiac tamponade, कभी देखा क्या cardiac tamponade एक केस को? नहीं देखा तो ICCU को जाके immediately पूछो मुझे एक cardiac tamponade चाहिए. Bed number 4. Then pigtail catheter ले लो, push subxiphoid area. The blood will come out of the pericardial cavity. Patient's dyspnea will come down. So putting a pigtail catheter and draining a cardiac tamponade. Wow. So that is the reason आपके internship में don't lose the chances. Last chance in life, doctor. Internship is all about full utilization. Otherwise, you will be left like a unfulfilled soul. Entrance के लिए क्या है? Hardly you don't need more than 300 to 400 hours of preparation. उससे ज़्यादा ज़रूरत ही नहीं है. Hardly 60 days बैठे तो रोज 5 घंटे खत्म, डॉक्टर टॉपर बन जाओगे. मगर प्रॉब्लम इज हम फिक्र ना ज़्यादा होता है. We'll keep on worrying. याद आएगा या नहीं आएगा, खत्म होगा या नहीं खत्म होगा, रिविजन कब करेंगे. Forget about all. No worries. Enjoy. Now, doctor, which intubation is preferred if there is a bilateral mandibular fracture? Usko to you can't do orotracheal, right? So for them, nasotracheal intubation is preferred. So what are the indications for intubation, doctor? Any depressed level of the consciousness, bleeding into the airway, falling oxygen saturation. इसलिए इंट्यूबेट करने के पहले क्या बोलते हैं? सिस्टर लिली, गेट द ABG, सेंड फॉर ऑक्सीजन सैचुरेशन. इफ इट इज फॉलिंग डाउन, PaO2 falling down, I like to check. Now, emergency endotracheal intubation, typically if the Glasgow coma scale is less than 7, right? So endotracheal intubation is indicated. What is that immunosuppression regime commonly used in a renal transplant to do the maintenance के लिए? Some of you are going to become world-class nephrologists managing renal transplant every day in and day out. As Dr. Murali Bharadwaj, I have a privilege of discussing this to the future top consultants. Calcineurin inhibitors, purine antagonists, and the glucocorticoids. So be very sure, doctor, a calcineurin inhibitor क्या होता है? Antigen will stimulate helper T cell. Helper T cell typically works on calcineurin. इसको calcineurin क्यों बोलते हैं? कैल्शियम का जरूरत है. Now calcineurin acts on enough ATC in, and once it blocks the two, if these two are blocked by calcineurin, it lead to interleukin 2 transcription. That lead to immunosuppression. So that is how calcineurin inhibitors ultimately will cause interleukin 2 transcription to get interrupted. So typically if you look at the various immunosuppressive therapies, another favorite question in exam, jhoot bole kavva kate, you should not forget these immunosuppressive mechanism. Jarur puchega examiner. Very easy. Glucocorticoids, then you have small molecules called immunophilin binding drugs. Immunophilin binding drugs. Uh, Immunophilin binding drugs. What are they? You have cyclophilin binding drugs, FKBP12 binding drugs. Cyclosporin होता है cyclophilin binding drug. Tacrolimus is FKBP12 binding drug. Then you have, there is something called target of rapamycin. Inhibitors of this target of rapamycin, वो होता है sirolimus and everolimus. Then what are the inhibitors of nucleotide synthesis, Dr. Purine inhibitors, pyrimidine synthesis inhibitors. So you should remember mycophenolate mofetil and mesoribin, they are purine synthesis inhibitors. Pyrimidine inhibitors, leflunomide, FK778, they are pyrimidine synthesis inhibitors. Azathioprine is called anti-metabolic inhibitor. Then sphingosine 1-phosphate receptor antagonist. Sphingosine 1-phosphate receptor antagonist. ये है fingolimod is the one which is called sphingosine 1-phosphate antagonist is what you need to basically remember. No worries. There are 750 MCQs in 50 topics in pharmacology, which we are starting a live YouTube discussion from tomorrow early morning 5 AM to 8 AM. मेरे प्यारे देशवासियों, NEET PG aspiranto, wake up at 4:30, put up an alarm and join the discussion and get ready for the exam. Right? Now, doctor, how do you manage if the subclavian artery got injured while you are doing central catheterization? Very commonly subclavian is artery injury hota hai. So basically you will use a closure device, covering stent, you will embolize that tract. That is how you will manage the bleed. Birad score, B bole to breast hai. Birad score is designed for what purpose? Fundamentally, mammography करे तो वो imaging findings को different people report differently. So in order to bring the uniformity in the reporting of the imaging findings on the mammography, BIRAD score has been devised. BIRAD 2003, BIRAD 2013. How will you call? Skin vascular popcorn, plasma cell mastitis, fat necrosis, calcium, dystrophic, eggshell, suture, they are all considered to be benign. Amorphous, coarse, heterogeneous or intermediate. Fine pleomorphic, fine linear branching on mammography, they are all considered to be high probability. Popcorn-like is typically benign. So ये होता है बिराद. आप सब अभी बिरादरी हैं. Now, breast cancer mainly spreads through Bateson's venous plexus. Splenectomy patients cannot be able to contain capsulated organisms. So H. influenza type B, meningococci, pneumococci, you will develop the vaccination. 57-year-old को pancreatitis होके, breathless होके, pulmonary edema है, मगर इसका central venous pressure less than 18, that means it is a non-cardiogenic pulmonary edema. Non-cardiogenic pulmonary edema, that means the pulmonary capillaries became leaky and there is a pulmonary edema. Not because of the cardiac failure. Non-cardiogenic pulmonary edema होता है. ARDS is what you need to remember. Now doctor, immediately after kidney donation, creatinine level क्या होता है? भैया suddenly increase होता है, डरना नहीं. Universal tumor बोले तो लाइपोमा, पूरा दुनिया में सर्वांतर्यामी है लाइपोमा. टेंडन ट्रांसफर का प्रिंसिपल्स क्या है? If you want to do tendon transfer, there should be no contracture at joint. The line of the pull must be straight. One tendon must do one function only. So doctor, what are the principles of tendon transfer? 5 principles, don't forget. The muscle to be transferred should be healthy. Muscle strength should be grade 4 to 5. There should be free range of movement. Any bone deformity should be corrected. It is desirable to use synergistic muscle. It is easier to rehabilitate. So what are the indications for tendon transfer? Paralyzed muscle, injured tendon, balancing the deformed hand, as in the case of cerebral palsy or rheumatoid arthritis. Now, pancreatic injuries. Serum amylase is elevated, peritoneal lavage not useful, penetrating injuries are very common, multiple injuries are typically seen. Water intoxication कहाँ होता है डॉक्टर? Typically in case of TURP syndrome, after doing transurethral resection of the prostate, you are trying to use a hypotonic fluids to wash that lead to water intoxication. Enema for colonic wash, gastric lavage, they lead to water intoxication. To maintain intravascular volume, you use dextran, hydroxyethyl starch and gelatin. So different types of IV fluids, what are the indications? Crystals, colloids, differences, you should be very sure. So we discussed all that in our surgery and made it available in onlineMBBS.com video library. अभी आ गया डॉक्टर इंटरेस्टिंग टॉपिक, जरा इसके ऊपर हम गर्मा गर्म चर्चा करेंगे 5 मिनट. Very good, doctor. Midline cecum. Where do you see midline cecum? It is a consequence of mixed rotation. Right? Now, how many types of errors of rotation of the gut? Non-rotation of midgut loop, reversed rotation, the transverse colon crosses behind the superior mesenteric artery and the duodenum crosses in front of it, reverse ho jata. Normally transverse colon should pass behind duodenum before, anterior to SMA, but reverse ho jata. Then non-return of umbilical hernia, typically during embryonic life, हमारा पूरा गट बाहर फेंक के फिर अंदर लेता है, like squash game. कभी कभी वो बाहर गए इंटेस्टाइन अंदर नहीं आता और बच्चा पैदा हो जाता. सो उसके वजह से होता है omphalocele congenital umbilical hernia. So non-rotation, reverse rotation, mixed rotation, 3-4 points about each of them. Non-rotation, it is also called left-sided colon. There is a normal first 90 degrees anti-clockwise rotation, but next 180 degrees of counter-clockwise rotation does not happen. इसको कहते हैं non-rotation. Because of that, क्या हो जाता है? Small intestine will lie on the right side of the abdomen and it enters the on the left side. The cecum and appendix lies just inferior to the pylorus of the stomach. Usually non-rotation of midgut loop is asymptomatic. So भैया ये है stomach. So cecum यहाँ आके बैठ गया. Typically the small intestine will lie on the right side of the abdomen and large intestine is in the left side of the abdomen. इसको कहते हैं non-rotation. Reversed rotation, इसमें normal initial 90 degree counterclockwise rotation, but the second 180 degrees instead of rotating anti-clockwise it will rotate clockwise. So the net rotation of the midgut will become 90 degrees clockwise. So the duodenum will come and lie anterior to the SMA and transverse colon will lie posterior to the SMA, and transverse colon may be obstructed by the pressure that happens because of the superior mesenteric artery and it become retroperitoneal. So the superior mesenteric artery compressing the transverse colon leading to superior mesenteric artery syndrome is the feature of reversed rotation. Bhaiya, some of you will do MS general surgery, MCH. वाह, वो नाम सुनते ही दिल में लड्डू फुटता. MCH, MS MCH, right? So when I was in first year MBBS, I came from a village, Telugu medium पढ़ के बहुत luckily आके medical college में गिरा. So that time we had a professor Shyam Sundar who was our principal of Gandhi Medical College. उनके प्रिंसिपल रूम के बाहर खड़े हैं तो उनका डिग्रीज देखे तो वाह ताज्जुब लगता. MS, MCH, FRCS, he also did diploma gynecology and also he is having FRCOG. कितना बड़ा लंबा डिग्रीज रहते हैं. हम तो फर्स्ट ईयर एमबीबीएस में सोचा भैया इतना डिग्रीज किया क्या बात है. दैट MCH used to look like a musical to listen, right? So some of you are going to become surgical gastroenterologists with MS, MCH, FRCS, right, doctor? So that day थोड़ा डॉक्टर मुरली भारद्वाज को याद रखो. हाँ, तो failure of the midgut loop to complete the final 90 degrees इसको कहते हैं mixed rotation. Because of that, there is an improperly positioned, incompletely fixed intestine prone to midgut volvulus. The cecum is fixed to the posterolateral abdominal wall with the peritoneal bands is what you need to remember. And because of this midgut volvulus in mixed rotation, the superior mesenteric artery can become obstructed. And that will lead to gangrene of the intestine. देखो, mixed rotation में the vessel get obstructed, whereas reversed rotation में the vessel will obstruct the colon. Colon को obstruct करेगा SMA if it is reverse rotation, whereas colon आके vessel को obstruct करके gangrene होता है mixed rotation में. That's the point you need to remember. So what is the clue that there is a malrotation? Third part of the duodenum is not in the normal retromesenteric position. There is a dilated duodenum with the obstruction caused by the Ladd bands is an indication there is a malrotation. Abnormal position of superior mesenteric vein going anterior or to the left and a whirlpool sign of volvulus is typically classical picture. So doctor, ये होता है whirlpool sign is typical of the volvulus is what you need to remember. अगर बेरियम करे तो malrotation से corkscrew sign होता है. What is corkscrew sign? It is the spiral appearance of the distal duodenum and proximal jejunum whenever there is a midgut volvulus. If you take a AP film, the duodenojejunal flexure is to the right of the midline and there is a proximal dilatation of the duodenum. There is a classical finding, and lateral view may duodenojejunal flexure does not cross the spine if there is a malrotation. So doctor, corkscrew कैसा रहता? Red wine bottle का cork निकालने के लिए you have above a dilated duodenum and then you are having a typical screwed appearance. So this is the typical corkscrew appearance is what you need to remember. Now doctor, what is the most malignant type of pustular psoriasis? Von Jumbusk type. Von Jumbusk type. So where do you see von Jumbusk? Patient will have fever, generalized weakness, severe malaise. So generalized acute pustular psoriasis को कहते हैं von Jumbusk is what you need to remember. Jagadishwar rightly says spirochetes have a corkscrew motility. Very good. So next to 60 days, 70 days, खाए तो भी पिए तो भी हवा लिए तो भी NEET PG का MCQs का Khana, pina, you should eat, you should drink, you should breathe. NEET PG, right? Now, doctor, this is how typically von Jumbusk acute pustular generalized psoriasis typically looks like. So, what is the most serious type of psoriasis, doctor? It is a generalized pustular psoriasis, which is a pre-malignant lesion. Lichen planus is pre-malignant. Herald patch, typically in pityriasis rosea, there is a 2 to 5 centimeter in diameter scale, pink, non-itchy, usually on the trunk. It can be mistaken for ringworm. That is the description of herald patch. After that, suddenly Christmas tree pattern में आपको पूरा tinea, pityriasis rosea lesions will typically appear. Koebner phenomena हम सबको मालूम है psoriasis में होता है. But examiner's favorite question क्या है doctor? Other than psoriasis, where do you find? You should be very sure. Even in molluscum contagiosum, psoriasis, warts, lichen planus, vitiligo, molluscum contagiosum, pityriasis, rubra, pilaris. Not only psoriasis, in all this you find Koebner, favorite question of the examiner. Iris lesions, where do you see iris lesions? Typically in erythema multiforme. Can you see, doctor? Iris. Iris दिख रहे ना? Dusky central disc. Infiltrated pale ring around it. Erythematous, edematous halo. Typically they are called herpes iris of Bateman. Erythema multiforme में you have dense vesicles, bilateral symmetrical, painless, but no itching. So these are the target-like lesions in erythema multiforme. And what lead to it? Sulfonamides, barbiturates, lamotrigine, phenylbutazone. They are the classical drugs associated with erythema multiforme. Now what are the causes of erythroderma, doctor? Erythroderma. So you should remember drug allergies, contact dermatitis, atopic dermatitis. Any of them can lead to development of erythroderma. A young boy has a dark patches, itching, and on rubbing there is a wheal. Rub करे तो wheal आए तो अब क्या है doctor? Urticaria pigmentosa. So urticaria pigmentosa spares the palms, spares the soles, face, scalp. If you rub, there is an urtication, erythema. That's called Darrier sign positivity. Very good. Yuvraj, मेरे मुंह की बात छीन लिया. Right? हाँ, very very important. Urticaria pigmentosa में होता है petechiae, ecchymosis, telangiectasis, etc. etc. Emotivational syndrome कहाँ होता है डॉक्टर? Cannabis. Fear for strangers and fear for reading preventive medicine. उसको क्या बोलते हैं? Xenophobia. Delirium versus dementia versus depression. What is the difference? Typically the sleep-wake cycle is grossly disturbed in delirium. Thoughts are disorganized in delirium. Recent and remote memory, both of them are disturbed in dementia. They are the main differences. So, bhaiya, bhajan karo, this is the favorite topic of the examiner. Delirium hota hai abrupt. The course of the delirium fluctuating. Duration is hours to weeks. Hours to weeks. Magar dementia will be months to years. Attention is impaired in delirium. Sleep-wake cycle is disrupted in delirium. NEET PG preparation के time में delirium is okay, not dementia. Alertness is impaired in delirium. Orientation impaired in delirium. agitated behavior, withdrawn, depressed, incoherent speech, disorganized thoughts, hallucinations, they're all delirium. फुटवा ले लो फेवरेट टॉपिक है, डेफिनेटली ये स्लाइड के ऊपर क्वेश्चन आएगा कल के एग्जाम में. Another thing, delirium, dementia, depression. Depression onset is acute, course can be chronic, duration can be months to years, but depression में consciousness is cleared, delirium में altered. Altered consciousness is delirium. Depression में consciousness is intact. Attention is impaired in delirium. Then psychomotor changes, increased or decreased in delirium. बहुत हिलते थड़पते delirium. Whereas dementia में you don't have any psychomotor changes. Delirium is usually reversible, but dementia, there are reversible causes, but irreversible. 18-year-old girl, breathlessness, anxiety, palpitation, tingling around the lips. Similar history in past. How to diagnose? Panic attack. Increased suicidal tendency क्यों होता है डॉक्टर? सेरोटोनिन कम हो गया तो हम जाके S for serotonin, S for suicide, S for smaller amount. Decreased serotonin lead to suicide. दुनिया वालों मुझे बदनाम मत करो, मेरा सेरोटोनिन कम है इसलिए मुझे जाके कुएं में कूदने का टेंडेंसी है. A man with intermittent hiccups is thinking that मुझे गैस्ट्रिक कैंसर है क्या? So इसको क्या कहते हैं? इसको कहते हैं हाइपोकॉन्ड्रियाक, हाइपोकॉन्ड्रियोसिस. So डॉक्टर हाइपोकॉन्ड्रियोसिस के बारे में गर्मा गर्म बोलो. Typically, these people have personality running in families. Sorry. They have a severe anxiety disorder. कुछ सीरियस प्रॉब्लम है मुझे डॉक्टर, तो जितना भी एविडेंसेस दिखाओ, एक्सरे दिखाओ, अल्ट्रासाउंड करो, कुछ भी करो, hypochondria continuously believes. Then somatoform disorders में 4 kinds: somatization, pain disorder, hypochondriosis, conversion. Somatization, multiple physical symptoms at different location before 30 years onset, you call somatization disorder. Pain disorder, persistent pain in specific area without any physical cause, pain disorder. Hypochondriosis, constant fear about the physical disease, hypochondriosis. And conversion, suddenly मुझे कुछ भी नहीं दिखा रहे डॉक्टर बोल के the guy will come running into your casualty. मैं अंधा हो गया, मुझे कुछ भी नहीं दिखा रहे डॉक्टर. Hypochondriac. Loss of sensory and motor function. So somatoform and pain disorder में there is a subjective experience of physical symptom with no organic causes. Then malingering में there is a deliberate faking of the physical symptoms to avoid an unpleasant situation. ड्यूटी पे जाना है, नाइट ड्यूटी पे जाना है, तो suddenly you will start saying, Chief, sorry Chief, I'm having lot of fever Chief. Your प्रोफेसर विल से अच्छा बेटा रेस्ट ले लो, नाइट ड्यूटी को नहीं आना, तेरे रूममेट को भी जाओ. रूममेट को जाओ बोल के बोलेगा, रूममेट तेरा ड्यूटी रूममेट करने के लिए जाता और तू रूममेट के गर्लफ्रेंड को कॉल करता, चलो आपका मजनू मेरा ड्यूटी करने के लिए गया, तुम और मैं जाएंगे मूवी देखने के लिए. वो होता है मेलिंगरिंग. Factitious disorder क्या होता है डॉक्टर? It is deliberate faking of physical illness so that you get all medical illness. Early morning patient आता है, खून डॉक्टर मेरे ऊपर मर्डर अटेम्प्ट हो गया. Actually he will put a little tilak, cosmetically creates as such, he is being torn with all injuries, right? Now, a incest type of relation between mother and son, इसको कहते हैं Oedipus complex. Obviously, sons admire the mothers and daughters admire the characteristics of the father. If you ask any girl, what kind of husband you want? मेरे पिताजी से better होना है, right? And boy will say, just like those beautiful eyes of my mom, I like to have the girl also with the same eyes. So, वो होता है Oedipus complex. Alcoholic says that he drinks to overcome the family problems. Oh my God. ये नीट पीजी प्रिपरेशन मेरे बस में नहीं होता. भाई एक बीर मांगो. उसको क्या बोलते हैं? इसको कहते हैं rationalization is what you need to remember. So, अपने बीवी को मर्डर करने के लिए क्या बोल रहे हैं? Sorry darling, there is a small fly, उसको मार रहा हूं, तुझे नहीं मार रहा हूं. That is rationalization. I failed because I attended the NEET PG coaching in this coaching center. ये मेरा कसूर नहीं है, ये कोचिंग देने वाला कसूर है. वो होता है rationalization. Bhaiya, what is anticipation? Anticipation is a mature defense mechanism. So, you should go back to the onlinemmbbs.com video library. You should do the review, doctor. Psychiatry में very high yield topic. One question generally आता है NEET PG में. Psychiatry easy to conquer. Just you need to invest 15 hours of your time on the onlinemmbbs.com video library. Done. You will make it. So, defense mechanisms is a topic, very high yielding topic. Personality disorders, very high yielding. Highest number of questions till now came in schizophrenia. Without a question of schizophrenia, there is no NEET PG. Now, doctor, if you know how to deal with the stressors by anticipating the consequences and the feelings associated with possible future events and trying to seek a realistic solution, इसको कहते हैं anticipation, a very defensive mechanism. We have only 70 days time for NEET PG. What are we going to do to manage this situation? If you do a proper planning, make yourself a bit disciplined and go to the entrance exam, वो होता है mature आदमी जो करने का चीज, anticipation. So the one who is getting old should plan for retirement, वो होता है anticipation. Affiliation, that is also a mature defense mechanism. If you turn to others for help and support and sharing the problems with others, but not trying to make someone responsible for your problems, वो होता है affiliation. Like going to a therapy, going to support group or spiritual counseling, etc. etc. Suppression क्या है? Repression क्या है? Anger हो गया तुझे, एग्जामिनर ऐसे बकवास क्वेश्चंस क्यों पूछते हैं? रैपिड सैंड फिल्टर में सैंड साइज, पार्टिकल साइज क्या है? My becoming cardiologist and examiner asking the stupid question. Is there a relation? No. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Examiner परमपिता परमात्मा है, कुछ भी पूछ सकता है. हाँ? No problem. This is a very good filter. जो नहीं पढ़ता है सैंड पार्टिकल साइज, उसको सीट नहीं मिलता, मुझे मिलता क्योंकि मैं पढ़ रहा हूं. So suddenly you suppress the anger consciously. That is suppression. Anger का situation आ गया और smiling. You can see a lot of politicians who come out of the central jail. They'll be smiling. They'll be saying like this. कभी भी आप न्यूज में देखे तो ये क्या है भाई, ये जेल जा रहे हैं और जेल से सब लोगों को स्माइल करते हुए वेव कर रहे हैं. So anger puts on a cheerful note, cheerful friend. So you are repressing, you are trying to denying the anger. That is repression. So doctor, repression, denial, projection, displacement, sublimation. You have to be very sure. Right? So इसका बहुत detailed review किया था हम onlinemmbbs.com video library में. Repression is an unconscious mechanism employed by the ego to keep the disturbing, threatening thoughts from becoming conscious. Then denial. Denial means you are blocking the external events from awareness. Smokers will refuse to admit themselves that smoking is bad. वो होता है डिनाइल. अगर आप पेशेंट को बोला, देखो गुलाम अली खान, तो ये स्मोकिंग बंद करो बेटा. अरे काय को बंद करना साहब, मेरा बेटे का मामा है, ससुराल वाले, और कुछ भी स्मोक नहीं करता, अगर उसको थ्रोट कैंसर हो गया, मैं क्यों रुकूं? आप भी शुरू करो डॉक्टर साहब, स्मोकिंग बहुत मजा आता है. दैट स्विटलिंग waves when they are leaving your two lips, you will get a feeling that chalo मैं भी एक cigarette लेता हूँ, right? So denial. Then projection means what? Unacceptable thought, feelings, motives. If you are attributing your own unacceptable thoughts, feelings and motives to another person, वो होता है projection. You might hate someone, but your superego tells that such a hatred is unacceptable. So you will solve the problem by believing that they hate you. Commonly husband-wife fights में ऐसे ही होता है. Husband hates wife. Instead of telling that he hates wife, he says, मुझे वो नफरत करता है, मेरा चेहरा भी नहीं देख सकता है. So that is projection. Then displacement. If you satisfy one particular impulse with a substitute object, वो होता है displacement. So, boss बहुत एंग्री है, HOD बहुत एंग्री है, तू आके तेरे गर्लफ्रेंड से फाइटिंग किया. So, उनका एंगर तेरे ऊपर, तेरा एंगर गर्लफ्रेंड के ऊपर, गर्लफ्रेंड जाके उनके डैडी से एंग्री हो गया. देखो ये कितना मेहनत करके नीट पीजी के लिए प्रिपेयर हो रहे हैं. यू आर नॉट रेडी टू सेट अप एन एंगेजमेंट, यू आर ओनली पुटिंग कंडीशन दैट ओनली अनलेस आफ्टर ही गेट्स नीट पीजी सीट, मुझे शादी करने के लिए बोल रहे हो, मैं जा रहा हूँ पापा. सो योर गर्लफ्रेंड वेंट एंड फॉट विथ हर डैडी. वो होता है डिस्प्लेसमेंट. एंड डैडी जाके उनके बेबीज को डांटा, उनके बेबी जाके उनके ड्राइवर को डांटा, उनका ड्राइवर जाके उनके ड्राइवर के बेबी को डांटा. देखो कितना रिपरकशंस हो सकता है नीट पीजी में नहीं सीट मिलने से. हाँ, नाउ रिग्रेशन. There is a movement back in the psychological time whenever somebody is stressed out. So a child may begin to suck their thumb again or wet the bed if there is a stress to go to school. Once more you will be going back in your milestones. That is regression. Then sublimation. If you satisfy an impulse with a substitute object in a socially acceptable way, वो होता है sublimation. Somebody very aggressive, पंच मारने को फीलिंग आता है सबको, वो जाके बॉक्सिंग में बॉक्सर बन जाता है, और he will become a big sportsman because all that aggression can be reflected in the game, right? So that is the story, doctor. Sexual perversion in which one has a desire to see a person or a wife having sex with others. What is that called? Voyeurism, peeping Tom. Then decreased sexual desire in a female is called frigidity. Medical termination of pregnancy may misoprostol is given after how many hours of mifepristone. So basically mifepristone breaks, misoprostol ejects. So 48 hours. Second stage of labor starts with full dilatation of the cervix, ends with the expulsion of the fetus. But what is the duration in primi gravida, doctor? Second stage of labor, 2 hours in primi gravida, 1 hour in multipara is what you need to remember. About the active management of the third stage of labor, you will give oxytocin. After the delivery of the baby, you will be giving oxytocin in order to stop the bleed, postpartum hemorrhage. Hormone replacement therapy का benefit क्या होता है? It will improve the urogenital atrophy, it will increase the bone mineral density, it will reduce the colorectal cancer. DUB commonly is anovulatory DUB. Hysteroscopy will identify any uterine synechiae of Asherman, misplaced IUD, submucosal fibroid. Hysteroscopy का contraindication होता है any pelvic inflammatory disease, you can't do hysteroscopy, vaginal bleeding or cervical cancer. Donald stitch operation for incompetent os, cervical insufficiency. Typically it can be done as early as 10 weeks. Marceline material is used and the stitch should be removed at 37 weeks of pregnancy is what you need to remember. So, Bhaiya, what are the absolute contraindications for cervical circlage? Any uterine contraction, patient is in labor, unexplained vaginal bleeding, intrauterine vaginal infections, rupture of fetal membranes, gestational age beyond 28 weeks, contraindications for circlage. Leffort typically is used in old menopausal women who is no more interested in having an intercourse. Now, gonococcal cervicitis, what are the complications, doctor? Finn's Hooge, Curtis, salpingitis, endometritis, anything can be caused by gonococcus. Criminal abortion what is the early cause of death? Hemorrhage, vagal inhibition, and fat embolism, anything can kill early. Septicemia is a late complication. Partogram, why will you use it for? Descent of head, uterine contraction, cervical dilatation को follow करने के लिए. Postmenopausal bleeding. Typically, what are the causes, doctor? Postmenopausal bleeding. Any senile vaginitis, decubitus ulcer, cervical erosion, any of them can be the cause of the postmenopausal bleeding. RH positive female, RH negative went for counseling. What will you advise them? No treatment is needed, only when the baby is born. During pregnancy, you need to give, and it is a second pregnancy where the complications will arise. ABO blood group, may O group ka, there will be a least chance of developing hemolytic disease of the newborn. Best fertility which uterine abnormality में होता है डॉक्टर? आर्क्यूवेट यूट्रस में. डाइकोरियोनिक डाइजाइगोटिक ट्विन में कितना मेम्ब्रेन्स होता है? So dichorionic is 2 placentas and diamniotic. So 2 chorions, 2 amnions, totally 4 layers. 4 layers are typically seen in dizygotic, diamniotic, dichorionic, dizygotic twins. Where do you see large for gestational age, doctor? Multiparity, postpartum pregnancy, diabetic mother, in सब चीजों में large for gestational age. Postpartum hemorrhage, what are the cause? Accreta, percreta, retained placenta, anything can lead to postpartum hemorrhage. Bartholin gland carcinoma can be adenocarcinoma, squamous cell carcinoma, adenosquamous carcinoma. How do you manage diabetes, doctor? Bromocriptine has a role in diabetic management. If you look at diabetes and bromocriptine lead to low dopaminergic tone in the hypothalamus in early morning in diabetes. The decreased sympathetic tone lead to decreased postprandial glucose levels and improved glucose tolerance. That's the reason it has a role. Dilutional hyponatremia, where do you see, doc? If you are using vincristine, typically vincristine will lead to inappropriate ADH production leading to hyponatremia. Then osmotic demyelination called central pontine myelinolysis. Locked-in syndrome is typically seen in the case of the pontine area. Now, hypokalemia, why does it lead to death? Hypokalemia can lead to prolonged QT. That lead to torsade de pointes, leading to polymorphic VT and ventricular fibrillation. And also hypokalemia can cause respiratory insufficiency. Filgrostrum is typically used for neutropenia. Spleen with deposits of amyloid in the white pulp of the spleen, इसको बोलते हैं sagospleen. Sagospleen. Then what is lardaceous spleen? Amyloid deposits may spare the follicles and they may infiltrate mainly the red pulp, producing a large firm spleen with a mottled waxy discoloration. That is called lardaceous. So lardaceous spleen is seen in diffuse amyloidosis. Finally, we reached the end of today's discussion, doctor. To confirm the systemic amyloidosis, you will take a full thickness biopsy of the rectum to demonstrate the presence of these amyloid deposits. मेरे प्यारे भक्तजनों, आप 2 hours we took to finish major part of the questions. So please call our helpline number 9000868356 in order to get the PDF of the key for all 300 MCQs. If you do one small favor, they will give you the PDF of all these 300 MCQs with the key. Just to send all the 150 classmates of you, वो सब लोग आपके WhatsApp ग्रुप में है ना, उसका नंबर्स दे दो हमारे हेल्पलाइन को. आपको in exchange to that you will be given the full question paper PDF with the key, right? And don't forget, every day 5 a.m. to 8 a.m. we will prepare together and become NEET PG toppers. Thank you very much. Enjoy a great evening, a long night, lot of topics to do the revision. You know where to look for them in the onlineMBBS.com video library. Good night.